From the New Orleans Convention Center in Louisiana, this is the ASN Kidney Week 2017 podcast, a discussion of the latest scientific and clinical advances presented at this year's annual meeting.
Hello everyone, welcome to Kidney Week 2017. I am Eleanor Lederer, and as president of the American Society of Nephrology, I'm pleased to be joined by three of my respected colleagues to discuss the events of the first day of our annual meeting in beautiful New Orleans, Louisiana. Can you all please introduce yourselves for our listeners and tell everyone where you're from?
Hi, I'm Sharon Adler. I'm a nephrologist at Harbor UCLA Medical Center in Los Angeles.
Good afternoon, I'm Michel. Chonchol. I'm a professor of medicine and an adult nephrologist at the University of Colorado.
And I'm Eugene Lin. I'm a postdoctoral nephrology fellow at Stanford University.
Great. Well, let's just jump right in. Guys, was there anything that really stood out for you on this first day?
For me, it was an amalgamation of everything that nephrology is and what we are and what we aspire to be. It ranged from the direct care of the nephrology patient and the acceptance of life care plans and quality of life for those patients, to safety of those patients in our hospitals and in our dialysis units, to protection from acute kidney injury for those patients and treatment for immunologic renal disease, all the way to basic concepts of new therapies and new ways to make access and new ways to make kidneys in a dish. So it went from nephrologists as caring caregivers, listening to patients and helping them traverse the problems of living life with kidney disease, all the way to eradicating kidney disease.
This morning I was present in a very exciting poster session that had a variety of topics on great, interesting new findings from, for example, different types of bone biopsies in different type of etiology of kidney disease. So how different bone biopsies across diabetes, hypertension, GN, and PKD have completely different fracture rates, to some data on acute kidney injury in the setting of chronic kidney disease, and studying a little bit the spectrum of AKI and CKD and how AKI is an important risk factor for mortality in very large cohorts. Even more exciting was some now newer immunotherapy for patients with adult dominant polycystic kidney disease. And this afternoon there was a really very exciting session pretty much about trends, medical management, surgical management of parathyroidectomy that was well attended. So again, really seeing a tremendous uptake from the nephrology community in different topics of nephrology.
Yeah, so this is only my third Kidney Week, but I think what's really struck me every time I come, especially like on the first day, is just how big of a community we have and just how many interests are represented, from people who are kind of just taking care of patients every day to people who are doing research, people who are advocating for patients, to even hearing from a couple of patients today at the plenary session. I just think that there's a huge community of people who really want to make nephrology an important area in terms of like the medical community and also taking care of patients with kidney disease. And I think that's something that's really exciting, especially as trainee. I always just like stuck in my own little bubble doing research or in our small division. But I think what's really amazing is just seeing a bunch of people come together by unified by something that they really love, and they're all kind of doing what they're doing best. And so I was really blown away by a lot of the research that people are doing. I think the poster session is like a great example of that. You can just see how many people are excited to do a lot of different things. Like you walk from one aisle to the next, and it's like you're jumping from health services research to disparities to AKI to biomarkers, and it's a lot to take in. I think sometimes it's tempting to be like, I need to see everything I want to. I think what's really nice is just seeing that there are so many different people excited about what they're doing, and we're all coming together to try to make the world a better place. I really love it here for that reason.
Well, that's great. Well, it sounds like a theme that each of you have expressed is the variety. Nephrology is not monolithic. It is just so many different things, and that it has something to offer to a lot of different people with a lot of different interests. So I was particularly struck by what you mentioned about the bone biopsies, and how for the longest time, I guess we never asked ourselves the question, is the bone disease that occurs with diabetes, is that different than what occurs with polycystics? Is that different than GN? And I think this goes very much to the theme of this year's meeting, which is the personalized nephrology.
Correct. And one thing to add is just being at the program directors meeting and the division heads meeting yesterday, there was this question of what other new procedures should nephrologists do, and I think there was a focus on tunnel catheters, on acute dialysis catheters, kidney biopsies, but something that is an opportunity to retake maybe our bone biopsies, because especially in this area of precision medicine, could be that the bone might completely be different according to the etiology of kidney disease. And I think this is something that would be worthwhile studying further.
I agree completely. So, yes, as you mentioned, you're new kid on the block. And so what do you, if you look back over your last 3 ASN Kidney Weeks, what do you think has changed in your approach to even coming to Kidney Week?
Yeah, I think the first couple of Kidney Weeks, I think I sort of came with this idea of, I need to hit every single session, and then you like open, I didn't even download the app the first time, but you look at the app and it's like there's a good 10 sessions for every 2-hour block, and then the poster session's even crazier, like that in and of itself counts as like 10 sessions by itself. And I think I was really almost like burned myself out really early, just trying to hit all of these different things. Whereas like last year and then this year, I've sort of tried to walk a little bit slower. And I think it's been nice because there's so much traffic. And as you start to meet people and get to know people, people who you haven't seen for like a year since the last Kidney Week, you like take it a little bit slower, and you kind of just run into people and you realize, I missed that session that I was planning on going to, or I only caught the last 30 minutes of that session, but then you really get to catch up with people who you haven't seen, and I think that really does help build this community aspect, not just all the knowledge. I mean, there's knowledge everywhere, and given how much is accessible just on the internet and from Google, you can always be learning. I think this is a phenomenal place to learn, but I think it's also like a phenomenal place to like build relationships. I mean, I had lunch with a friend from residency who I hadn't seen in a year, and it's just a really great place to, nephrologists are all really nice. I mean, my wife always tells me, she's like, nephrologists are so nice. And so, and I think it's really a great reminder of that.
It's interesting that you mentioned that, because I know that for many of us, seeing the friends that we only get a chance to see once a year is really one of the big treats of coming to Kidney Week. And I recall perfectly well my first couple Kidney Weeks were complete chaos, complete and utter chaos. But one of the aspects that remained an anchor was the fact that every year after year, I would see some of the same people. And you began to realize, yes, this is my community. I may only see them once a year, but it's my community. These are my guys. We're all interested in the same thing. So I think that's really important. I just ran into an individual who had been a research fellow for just a couple of years in Wadi Suki's lab while I was down there. He's from Brazil. Wow. And there we were, out in the hall, my God, of all the, thousands of people that are here, there he shows up. Amazing. So have any of you guys seen or heard today things that you think are going to change your practice?
So I'm privileged to participate in the collaboration between the ASN and the Centers for Disease Control in targeting zero preventable infections in chronic dialysis facilities. And I was at a focus group today, and we talked about why we have so many catheters and barriers that we have for the removal of catheters, including, how do we get vascular access in patients who have Medicaid or Medi-Cal, which is a problem, and suggestions like ASN perhaps reaching out to vascular surgery associations to make those connections and find the vascular access docs who are more interested in rapid turnaround with vascular access. And how do we get our dialysis units to function at a higher level, to increase the hand washing rates, to make sure that the catheter sites are cleaned with chlorhexidine and dressed at the end with an antibiotic ointment. And to make sure that both the technician and the patient are masking when these things are done. The little details in dialysis care that can lower the infection rate. How do we get the patients to wash their access before they depend on the staff to disinfect, which I always find actually a problem. How do we get each of us interested in knowing what our bloodstream infection rate is and who should be an antibiotic or infectious disease steward in our units? And for each of us to go back to our dialysis units and be proactive in these areas. The ASN, and particularly the Nephrologist Transforming Dialysis Safety Group, is currently actually preparing a curriculum directed at fellows, but we also know it's going to be helpful for us. I know I'm leading the charge, and I can promise you it will be helpful for me to develop a curriculum that will be useful to all nephrologists, not only nephrologists in training, so that each of us can develop a culture in our units of how to become sensitive to the infection prevention issues in our dialysis units to make dialysis safer for our patients. So I would hope that everybody would be looking for this curriculum. We're planning for it to be out sometime in the summer, a long version with clickable links and friendly figures and tables, and a short version which is likely to be in one of the major nephrology journals.
Well, that's just awesome. Now, you've been in charge of dialysis unit, right?
Yes. Mm-hmm.
And what is your take on this initiative between the ASN and the CDC?
Yeah. So I'm currently medical director of 2 chronic dialysis units at the University of Colorado, and I think this is a tremendous initiative. I think the nephrology community, rightly so, has focused a lot, obviously, on cardiovascular events as the first cause of death in our patient population, but I think we have forgotten about the contribution of infection to the comorbidity of our patient population. And I'm very happy and glad to hear this collaboration between the ASN and the CDC to really see the infection again at the forefront of our target, one of our main targets, to improve our patients' lives.
Well, I'd like to follow up on that because the USRDS has now presented data that the cost of inpatient cost for hospitalization for ESRD patients with infections now exceeds the cost of inpatient cardiovascular disease care.
Yeah.
So,
which is an astounding figure, an absolutely
Yes.
astounding figure. So for the two of you all, then, just this new initiative, which is being broadcast in at least 3 different settings here at ASN Kidney Week, this is something that you feel has the potential to really change nephrology care.
I do.
Absolutely.
Yeah.
I do.
Absolutely. And improve outcomes of our patient population. Yeah.
Absolutely. How about from you? Anything that you see that makes you think I'm going to change something?
So nothing necessarily immediately, but so my research area is in health economics, and one of the things that I'm interested in is how do you translate scientific advances into everyday practice. And I'm also a member of the policy board, and one of the things that we've been talking about, and something I've sort of been seeing the nephrology community sort of starting to take an interest in, or like have a passion in, is how do we manage the transitions of care, not just in our dialysis patients, which I think rightfully they have commanded a huge portion of our attention as nephrologists, but how do we take care of our patients who pre-dialysis? How do we manage the transition from chronic kidney disease to dialysis, or from dialysis to transplant, or CKD to transplant? And how do we do that in a way that is meaningful for patients? So I think kind of getting a sense for what patients value in terms of the outcomes that they value, and kind of moving away from the business and the everyday practice of being a nephrologist, but more sort of saying, okay, I see a patient longitudinally, and how do we kind of best manage that patient over a long period of time? And so I think that's something that it's really hard to translate into like an everyday practice sort of thing. It's sort of more of a how do you think about developing a system or systems, like what one provider does to effectively manage a patient longitudinally might not necessarily work for someone else, but how does ASN as a community, how do the community providers, how do they come up with a lot of different solutions that help patients where they are, and kind of help them figure out and help providers figure out, how do I best deploy the things that I know? Because I think we learn a lot of things, but I think what's really challenging for, I'm sure for all of us, but for me in particular, is when I see a patient, it's sometimes very difficult to have a cooperative or team kind of situation where we say, oh, I know all of these scientific things, but how do I help you? How does this change your life? How does it make your life better? I think patients who just spend all their time thinking about, counting potassium and all these other things, that's not really living. I think we need to figure out a way to, make their lives more manageable. And so, yeah, from a research standpoint, and just from thinking about how do you change a system standpoint, I think it's something that been thinking a lot about. I mean, it's a theme that's echoed in pretty much every single seminar session that I've gone to, and every single poster session that I've gone to today has been talking a lot about this. And I think that's something that hasn't been the focus of a discussion 3 or 5 years ago, for sure.
Well, that's a unique observation, and I never really, heard that articulated about this meeting. So I just went to the nephrology quiz and questionnaire, which, as you all know, is now, a recurring event, and is always, at least in my mind, a lot of fun. Because they, present a couple cases, and then they get the vote. What would you do? What would you do? Et cetera. So I generally come away from those sessions with a new nugget of knowledge. Because you can't keep up with everything.
Yeah.
I mean, you just can't. And to have, in a little nutshell, somebody say, okay, this is how lithium causes nephrogenic DI. Here's what we can do, and here's what's on the horizon, perhaps. I think that for me is a very, very fun session. I enjoy that tremendously.
As an aspirational session, I just left one that was a bit like the discussion of the matrix and how important it is in making a vascular tube. This one focused on matrix and how it permits the development of the microvasculature of the kidney in a dish and recruits podocytes for the development of a little kidney in a dish. So we go from concerns about diet and bone disease and how to make a patient's life on dialysis better, all the way to to nephrogenesis, man-made nephrogenesis, which is spectacular that it all sits here in the same meeting.
Absolutely, absolutely. And I think today's plenary session, the state-of-the-art talk was really fantastic.
Yeah, I agree.
Growing a vascular access. And then the way she talked about it at the end, we're going to crank this up 5, 10, 80, 100, pretty amazing process that she has gone through to get this successful. Pretty excited to see what's going to happen with that. I know that I work at a VA hospital, and so a lot of the older patients, coming to end-stage kidney disease who want to go on to hemodialysis, finding suitable vessels is sometimes really a challenge. And our failure rate for primary fistulas is really quite high. So having an alternative that would allow us to make fistulas, avoid the catheters, avoid the complications that are associated with catheters, I think just sounds like it's phenomenal to me.
And if you go to the late-breaking clinical trial on Saturday, you may be able to see how interventional nephrologists can enter and offer some to this issue as well.
So
Sneak preview.
there we are. That's right. To be seen and heard later on in the session. So any other parting thoughts at this point? Okay, well, I'm looking forward to tomorrow and the rest of the week. Hopefully you guys are too.
Yes, for sure.
All right, and thank you so much for joining this session.
Thank you.
Thanks.
Thank you for inviting us.
You have been listening to the ASN Kidney Week 2017 podcast. This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.